We have a lot of influencers on Instagram and TikTok and all those people. They promote their medications, their creams, celebrity creams and all that. They're expensive,
Right.
and there is no active ingredient in them. If you act, because I have looked at all these ingredients and I've checked, and there's really no active ingredient in them. They're just basically moisturizing creams and lotions.
So, welcome, Dr. Joe Thomas, to another episode of MedVentures.
Thank you.
You're on the hot seat mainly to discuss about the most hot and happening branch in medicine, which is dermatology.
Yes.
Now, anything and everything is about skin,
Yes.
about hair, and everything comprises in the field of dermatology. So, what is exactly dermatology in a nutshell, and who is a certified dermatologist?
Okay. Dermatology is a branch of medicine that deals with the skin, diseases related to the skin. It's and also dermatologist is one who deals with those. He is certified. He has studied the entire process, the physiology, the biochemistry, the entire molecular genetics of the tissue skin. So he's one who specializes in dealing with.
So, what is the average course, or how is the duration of becoming a certified dermatologist?
Yeah, so after you finish your medical school, your graduate school, you have a 3-year postgraduate degree. And after that, you'll have various fellowships which will take you into subspecial fellowships, like you want to do cosmetic surgery, or you want to be into the more in-depth pediatric dermatology, dealing with children's skin diseases. So it branches out like that. So about maybe 3 years is the main postgraduate degree, MD degree. Then after that, another 1 or 2 years for your fellowships.
So, what are the different branches? Because what I know is only about cosmetology.
Yes.
What are the other branches which are available?
So the original, when you say I'm a dermatologist, it means MD DVL. So you have dermatology, you have venerology, and you have leprosy. That is here in India, because it deals with skin diseases, sexually transmitted diseases, skin diseases, and also leprosy. That is what the full form of DVL is. Cosmetic just came recently. So now they're adding aesthetic medicine along with DVL. So DVL plus aesthetic medicine. That is.
So do you complete aesthetic medicine too?
No, that is right now. It is included in the course, but they advise us to do a fellowship after that into aesthetic medicine. So most of us, after we finish our MD degree, because we focus mostly on general dermatology during our MD course, after that we have to specialize into the cosmetics and aesthetic medicine. So we do fellowships in that, and that is innumerable branches other than aesthetic medicine.
So in the branch of aesthetic medicine or cosmetology is something which is very rampant or happening right now. We see a lot of advertisements. We see a lot of on digital media regarding different procedures related to cosmetology, different types of creams or different types of products for dermatology. What should people actually visit a certified dermatologist before using these creams or medications, or is it over the top? What should be done?
See, usually over the counter medications, it's a hit or miss. It may or may not work with you, but there are some ingredients that individuals should be careful about before putting on their face. But generally speaking, most of the over-the-counter medications are considered generally safe. But it would be always best to visit a dermatologist before you consider putting such type of substance on your face. Because we know best what is ideal for your skin.
Right.
So it's best to first visit us, and then we will tell you from there.
So since we just mentioned about the term aesthetic medicine and cosmetology, what is commonly talked about are three important topics: Botox, fillers, and IV glutathione.
Yes.
What are they? What are they used for?
So Botox and first I'll talk about Botox and fillers. Botox is basically a toxin released from a bacterium, Clostridium that. So what it does is it paralyzes the muscle and makes it so it reduces the contraction muscle that causes the frowning on your forehead and your and around your eyes. So it's used to make the skin smoother.
Okay.
Botox. Now, fillers, on the other hand, it is used to fill up a defect in your under the skin. So maybe you might not have enough uh, fat under the skin. So you'll have a more hollowed out face.
Okay.
So when you give fillers, what happens is it pops out, comes out, and fillers are mainly made up of this collagen, synthetic collagens, which are injected into your face, and it brings it up. But the problem is, this is a very temporary solution.
Okay.
And so only disadvantage fillers is that after 6 months, you will have to keep on doing it. But the results are good. People with some people, they're not happy with their lips, particularly women. They don't like the lips that God has given them, so they would like to make it more fluffy. So, so they go through these fillers, and it makes a big difference to the appearance. It really makes it look full.
Okay.
Now, Botox is also another good option for people who are in their mid 40s to early 50s. They want to get back that youth.
Right.
So the best way, without going under the plastic surgeon's knife, to get that youth look, you can just give a few injections at certain points. Your forehead line over here, glabella lines, your mouth wrinkles, your eye. You just put at these points and you are a young man. So that's the thing about Botox. Now, Botox, if not done properly, can cause a lot of unwanted, unpleasant problems.
Okay.
One such major problem is you have this type of ptosis we call, where the eyes, they move upwards like this. You cannot move one side of the face.
Okay.
But the thing is, if you're a person who's like for example, a TV personality who comes on TV, you need to have something to counteract that. So they give you some eye drops which you can apply and to counteract whatever overaction of that that Botox you've injected in. So it is something that you should go to a specialized dermatologist who specializes in this thing. You can't just go to any random person. It is a very technical procedure. There's a lot of anatomy involved in when you're doing Botox injections. But if done right, it's a wonderful therapy
Procedure.
Therapeutic procedure. It's a wonderful therapy.
So, to what I understand, that since it's an injection, it's a bit of an invasive procedure.
No. So the thing is, that's what, when we say invasive, we call this non-invasive cosmetic procedures because you're not technically doing any surgery on them. You're not putting any stitches or anything. This is just injections.
Okay.
So we are not doing any major alterations of the face, because guaranteed after 6 months, all these, whatever you have injected on the face, it will all wear out. It will be absorbed.
So if a patient comes to you after a session of Botox or fillers,
yes,
what is the duration of one session of Botox and fillers?
So if done correctly, a Botox or a filler will last you good for 6 months. Then you'll have to come again for another session, most likely. So it's not something that is permanent. That's what the viewers here should realize, that Botox and fillers, they have a limited action.
Okay. Are these non-invasive procedures expensive?
Yes, they are expensive. Yeah, you have to talk to your dermatologist, and they will give out there will be packages that will be provided by each clinic or institution you go to.
Right. So is all procedures done in one day, or do people have to come for multiple sessions for a Botox injection?
No, it's a single day injection. It's a single day.
So it's more of like a daycare procedure. Yes. What is the time duration for one single sitting of Botox?
So basically what they're going to do is they're going to identify the points where they're going to inject the Botox in. They have to assess the plane at which you have to inject into that muscle. At what point so it's basically a few minutes, that's all.
Okay.
But they have to be accurate at where they hit. The points at where they hit, they have to be very accurate at that.
Apart from Botox and fillers, something which is very commonly heard over social media is IV glutathione. What is your opinion about it?
So the IV glutathione rage has been going on for quite some time. Not only in India, we're talking about China, Korea, all these places, because we have this fantasy for fairness.
Right.
We love to look white.
Right.
There is no concrete evidence to say glutathione can help in making you glow.
Right.
But it's so I'm not so much in favor of these things, IV glutathione injections.
Okay.
It's more of a fad, which I feel that will wear out very soon.
So should the younger generation kind of avoid these injections?
There's no harm in taking these injections. There are very few reports of allergic reactions to it. Okay. It's basically an antioxidant.
Okay.
Glutathione is an antioxidant. We give it for all types of diseases, people with liver diseases or some chronic disease. We give glutathione, which helps as a supplement to allow the cells to grow and divide healthy, to have healthy tissue. So it's not a harmful thing to get.
Okay.
But people should not have this assumption that glutathione will make you Snow White. Right. That's a thing that I would like to put forward.
Because I think especially young girls who want to go into maybe before their marriage, before a particular function, a sudden glam, a sudden kind of change in their face is what they are expecting.
People should not fall for those kind of things. There's no sign. If the science was there, I would have said, okay, fine, I agree with it. But I don't see concrete scientific evidence to say that glutathione can help you make you look white.
Okay, so, but can it be risky?
It's an antioxidant. It's not hard. So we get it on Amazon. Glutathione capsules. You can take that. It's not going to harm you. Very few reports of allergic hypersensitivity reactions were there, but you can take it, not at all.
So is IV better if to be taken? IV better or oral tablets better, or is it the same?
For me, I feel it would be better if you take it oral more than IV.
Okay. Fine. And for how long?
See, like I said, it's an antioxidant. It's like taking a vitamin tablet. Okay. You can take it lifelong. A glutathione capsule once daily. Now the vitamin industry is booming. Right. People are taking vitamin tablets in and out. It's not going to. We are taking a very minimal dose also, so it's not a very high dose of glutathione you're taking. It's not going to hurt you in any way if you take it in a moderation. Right.